Hydrocephaly, what it means? Hydro
Water
means
and water.
water. Cephaly means
Brain.
head, and hydrocephaly is
Water in the brain.
hydrocephaly is increasing CSF in the brain. You know what is CSF?
Cerebrospinal fluid.
What?
Cerebrospinal fluid.
Cerebrospinal fluid. Definition: hydrocephalus is a condition where cerebrospinal fluid or CSF accumulates abnormally in the brain's ventricles, and increase intracranial pressure. Okay? This is hydro means water and cephalus means head, and literally water in the brain. Okay? This is hydrocephaly. You can see these children in the wards. We say hydrocephaly. How are you? Where are you in last session? Absent?
Yes,
We didn't have absent.
Not acceptable.
Bye.
Not acceptable.
Because all of things I say in the class are very important for you as a nurse.
Yeah.
And including your
Of
school.
course.
Didn't absent. Turn off your cell phone, laptop, everything. You didn't need any of them. Hasane, turn off your cell phone. Look at the picture. This is hydrocephaly. How are you absent, girl? Usually you are absent. How are you? This is hydrocephaly. This is my subject today.
Okay.
And the causes. What do you think about the causes?
Genetic.
Genetic.
Yeah.
You see in my lesson, genetic is very, very important. How are you, nurse? Abdullah.
Yes, doctor.
Abdullah.
It's first.
They say Abdullah is absent.
No,
No, it's hair.
it's here.
How many Abdullah we have?
Only
One
me
more.
in all the university.
Only you? Okay, Abdullah.
The first session
Please explain what the cause of hydrocephaly.
the congenital, I mean the
Number one, congenital.
That means genetic.
present
Genetic
Yes.
is the first.
Genetic.
Number two,
Neural tube defect.
Defect.
Okay.
Okay.
By me,
What
Milligan.
sometimes, many times, meningocell and meningomyelocell, as I told you, are with congenital or
acquired
acquired hydrocephaly.
Yeah.
They are with each other. Okay? Sometimes, not always, you have entities with hydrocephaly.
Yes.
Okay? Genetic. Pay
Abnormalities,
attention.
yeah.
Genetic. Is it congenital or acquired? Yes. We have acquired also. I will say. Acquired means because of meningitis, because of brain tumors, because of intracranial hemorrhage, we have hydrocephaly. Okay? Hydrocephaly is congenital or acquired. We have two types of hydrocephaly. Yusuf, Sama. Coming?
Yusuf Sama.
Okay.
Come on right now.
We marked you as absent last session. Okay. What did you say about this slide? Types of hydrocephaly. Number one, communicating hydrocephaly. What it says? Read it, please. Please read. Read.
Communicating.
hydrocephalus. CSF can flow between ventricles, but absorption is combined.
Okay? What it means? You know CSF
Yeah.
is produced every day. In you, for example, 150 cc per day, we have CSF. And it absorbed.
Okay.
Yes.
Where is the ventricle?
Ventricle in the brain. I will show. Where is ventricles? These ventricles in the brain that produces CSF. Okay? The absorption is
Impaired,
impaired.
yeah.
Okay?
That means
Number one, communicating, all of ways are open or only absorption is impaired. Number one, question of exam, final exam. And number two,
Question of exam.
Ahmed Khalid.
yes.
Ahmed Khalid. Okay, please repeat. Number two, communicating.
Complicated is obstructive. That means block in the
We have
CSF block is the
stenosis.
block inside the ventricles.
Stenosis
Yeah.
in the way,
Yeah. That means block.
blocked because of and led to hydrocephalus. Okay, your absorption is normal, but the vase is closed. Okay,
Okay.
this is non-communicating or obstruct.
Okay.
Okay, do you find it? Do you find it? Okay. Symptom.
Enlarge height.
Okay. Yes. Symptom. Enlarged head.
Yeah.
Number two. What is fontanelle? Fontanelle. Where is your fontanelle?
It's a hole.
Superior, posterior fontanelle. All of us, we had two fontanelle in the time of neonate. Dr. Tajali said to you, yes? Yes. Okay, bulging fontanelle means,
Soft.
okay, and vomiting, and seizure. What we have seizure? Why we have seizure?
So that affects in the brain.
Pressure,
Yeah, pressure, that
intracranial
affects the
pressure
brain.
increase and led to seizure. Seizure, convulsion. What is this? Seizure. What is seizure?
So that means trauma.
Seizure. Seizure.
Seizure.
Seizure. Seizure.
Shivering.
Developmental delay. Brain developmental delay you have. Let me, I will say, let me. These are symptoms. You have the children like this, enlarged the head. Okay? What did you see the eyes? It says sunset sign. Sunset sign. Okay? I will show it more to you.
Yeah.
This is your brain, maybe some tumors growth in the brain and led to increasing ICP and led to hydrocephalus. Maybe these tumors benign, maybe cancerous, maybe led to hydrocephalus in children. This is a baby, sometimes a head is enlarged more than the other parts of the body. This is a hydrocephalus. Many of these children died, expired.
Texture is permanent or not?
What?
Permanent?
Yes. Some of them expired. many of them in delivery room expire because of increasing ICP. Okay?
Inshallah.
Inshallah? Inshallah expire?
No, I mean
Intra.
intracranial.
Cranial abrasion.
Okay. This is hydrocephaly. Okay? Enlarged head and led to death. This is hydrocephalus congenitally. Yeah, these are ventricles. You ask me where is the ventricles. You can see the brain and you can see ventral ventricles.
Third,
And you have some foramen. Number 1 is Monroe.
fourth,
Number third is third ventricle. And number 2 is Sylvius, for example. And fourth ventricle. These are the ways that CSF
accumulate.
comes to absorption in cisterna magna. Okay, these are CSF. Okay, you can see blue lines. Blue lines of CSF. Okay,
Okay.
and if the vein is obstructed and have a stenosis congenitally, the cause is unknown, led to hydrocephaly in neonates.
Doctor, in the second type,
I will say.
obstruction,
I will say.
what's happened?
This is ventricles that in CT scan enlarged, full of CSF and under pressure. These are white parts are related to CSF. This is ventricles in CT scan or MRI. You can see
Full of CM.
enlargement. This is, you can see CSF, okay, in the brain. This is also arachnoid villi, sagittal sinus, and the subarachnoid space. That these are full of CSF. We need to CSF in our brain. Diagnosis. Number 1, MRI, CT scan. You can confirm hydrocephaly for children. What's the treatment? Surgical. Neurosurgery ward. A special doctor in this surgical do for them. For surgery, it is necessary at the first put a shunt. What is shunt?
It's a tube.
Ventricular peritoneal shunt.
It
What
moves
is
the
this?
it moves the fluid from the head to the heart.
Ventricular to the peritoneal.
Yeah, exactly.
Where is your peritoneal?
What?
You, peritoneal. You know peritoneal? What is peritoneal?
Yes.
Where is it? Where is your peritoneal? The nurses that we had in surgery, what is peritoneal? Peritoneal. In abdomen. You have peritoneal. Peritoneal. Anatomy. Peritoneal. Peritoneal. Why you
Cavity.
a liar in your body is peritoneal.
Doctor, can we move this into the heart? I've seen
I
some
will
shunts.
say, I will show you. We put a shunt between ventricle and peritoneal. I will show this shunt to you. Number 1 is ventriculoperitoneal or VP shunt. Drains excess CSF to abdomen for absorption. Number 1. Number 2, endoscopic third ventriculostom. What is this?
Opening in the ventricular.
Opening from fontanelle goes to ventricle
To third ventricle.
and
cat.
And
Cat the
drainage
Yeah.
the CSF. Number 2.
medical.
Okay, do you find it?
Yeah.
What is this? What is this? Explain more. No nursing care. This one. Number 1 was shunt. Number 2 was endoscopy, ventriculostomy, ETV. Create a new pathway for CSF flow.
Flow.
If you go to surgery ward, sometimes the doctors, the neurosurgeons put a drain in the brain and connect it to a bag.
Okay.
It comes out and comes to the bag.
Also, it's permanent or we.
No, these are not permanent. These are temporary.
Yes, home.
I will say, I will show. Number 3 is medical. We use some drugs to decrease CSF. Okay? What are these drugs? For example, acetazolamide. You know acetazolamide? That's a drug that decreases CSF secretion. And you as a nurse, what do you do?
What?
Nursing care.
Yes.
Measure the size of the head.
For hydrocephaly.
For post-surgical,
Yes.
monitoring the
Monitoring the other one.
the amount of the drain,
Okay. And
also the vital signs, maybe have intracranial pressure or something.
pay attention. Number 1.
Is the measure.
Here's head circumferences, monitor neurological status, sign of intracranial pressure, keep VP shunt site clean and monitor for infection.
Yeah.
Many times we can see these children in the ward
With
because of
meningitis.
infection, meningitis. And it's very important shunt for you. I said to you, what is this?
Luminal.
Spinal bifida,
bifida, yeah.
meningocele, meningomyelocele, maybe with hydrocephaly, with each other. Okay? Your baby
It's a
have
kind of
hydrocephaly and meningocele or meningomyelocele with each other. We have the other things that you can see in the pediatric ward, that is craniosynostosis. Okay. It will continue, hydrocephaly continue. Please introduce it for me at the first. At the first. At the first. Not finish. I continue. Hydrocephaly continue. At the first, please clear this for me. What is this?
You want to read?
Read.
Is
Craniosynostosis is the other defect, the other abnormality that we have. Okay? Read please.
Is a birth defect in which one or more of the sutures in baby's skulls.
Do you know about sutures in the skull?
Yes.
Sutures, foot tunnel, and the other sutures that we have in our skull in the neonatal period. Okay.
Sutures in baby is open,
Okay.
but here is closed.
Closed.
Closed premature.
Doctor, we have 4 sutures. 3 sutures.
3.
Okay, what happened for your sutures in craniosynostosis?
Open. Close. Close.
Closed,
Premature.
Premature.
premature. And cranial means skull, and synostosis is fusion of the bones. These are sutures in your brain, in your skull. And these are closed prematurely and led to.
Accumulated.
What about
My question.
Okay. Let me finish our everything about hydrocephaly. If you have question, I ask.
Maybe I forget that.
What? You forget that
Right here.
your brain is good. Not hydrocephaly, not craniosynostosis. Pay attention, not forget your question. What do you see in this picture? This is craniosynostosis. Means the closure
Of the suturing in the head.
Prematurely.
prematurity sutures
And
of the
development
skull.
cannot happen.
And your brain is under pressure. You can see these children in the pediatric wards in this form. Okay? These are typical form of craniosynostosis. It is after surgery. They go to neurosurgery wards and open the sutures that is closed. Okay? This is craniosynostosis. What's the cause? What do you think? Genetic, unknown. We didn't know why your suture closed premature.
Doctor, can family marriage cause
Maybe
Chromosomal
all of
variation.
these that I said up to now, familiar marriage, genetic, unknown, drugs, cigarette smoking, alcohol, led to maybe. What do you see in this picture? This is hydrocephaly. Sometimes the head is enlarged, too much bubble,
Yes,
too much. You can see the table, no?
yeah.
Okay. I arranged the class walker
Yeah.
without let you. The girl on that and the boy
Why
in
did
this
you
part and
divide them?
arrange.
لأنه هيك.
Why
This
did
is
you
better.
divide them
This
differently?
is better.
Why, doctor?
Okay.
أجل.
This is hydrocephaly, congenital hydrocephaly, that's birth. Okay?
Doctor,
disgusting?
in these cases,
Let-
they still alive or die?
What's your idea?
Die.
Also
Many of these babies before surgery die, expire. Because ICP, because seizure. Okay?
So why
Because
we-
your brain
This
is
is
under
doing
pressure.
surgery.
What?
Why we did doing surgery?
Why we doing surgery? Do
Why
you
we
think
did
that
doing surgery?
I will say to you, this is hydrocephaly. This is sunset side. Question of the exam.
Question of
What is sunset side?
Question of exam.
Please read Robot. Where's Robot? Okay, thank you.
The sunset sign refers to downward division of the eye,
Deviation.
deviation of the eye, where the lower part of the earth is covered by lower L, making the eye appear as if the sun are
Sun are setting. Okay, because of intracranial pressure, you have sunset sign. Look at the baby and you see this form of eyes. Sunset sign. Question of exam.
So.
Please read all of my files carefully and get ready for exam. Sunset sign. Sunset
The
sign.
knowledge is important. Final exam, nothing.
Bulging occiput sometimes. Bulging fontanelle sometimes. Nystagmus
Nystagmus and
sometimes. Nystagmus sometimes. You can look at the eyes.
Yeah.
Nystagmus. Estrabis sometimes. Estrabis.
Strabis.
You read eye.
Yes?
Yeah. We take it out, yeah.
Strabis, yes.
Not Farsi.
That's it.
Yes,
In
that's
Arabic.
Farsi.
Person.
Increasing
The floor
CSF in
and
the
the head.
ventricles, and you can see CT scan of these patients. Treatment. Number one was shunting, putting shunt.
Yes.
For all of babies, try to put shunt, okay? That is permanent. And this is for diversion of CSF. And number two, repeated lumbar puncture.
Puncture.
You know what is lumbar puncture?
Yes. Inspiration. Doing
What
it.
is lumbar puncture? You remember your question?
Doing inject.
What is LP? LP, lumbar puncture. What is it?
Taking CSF sample from lumbar area.
Lumbar area. We do it that is invasive for decreasing CSF for the hydrocephalus children. That is rare, but maybe you can see this method. And sometimes we use some medication. As I said to you, astazolamide is the first drug for decreasing CSF secretion. And sometimes furosemide and isosorbide reduce CSF production. If you have tumor, for example,
Remove it.
or kyst, it's better to remove it. Do surgery to remove tumors. Shunt is the better. The best treatment is putting shunt. I will show it to you shunt. What is shunt? It's a tube that one day is
From the head
under
to the heart.
ventricle and the other one is number one. In pre-one, this is pre-one.
Yeah.
The book says put in the heart, in the
In which area? In the heart.
atrial. What's not advised?
Why not?
Why not? Because that's harmful for your heart. In the books they say. Okay, this is shunt. Number one,
Doctor.
ventricular.
This one is
Internal?
internal.
Yes,
This
I
side.
will show it to you. This is internal. This is internal, okay?
The abdomen will absorb that.
No, absorption happen in abdomen, in pre-one. In pre-one. Okay?
Not lumbar.
Dr. Amar has a
LP also lumbar puncture, okay? Do for decreasing CSF. This is position of lumbar puncture that you can see in pediatric wards, LP. Lumbar puncture. Shunting. Ventriculo-atrial means ventriculo-atrial means
To the heart.
I show it to you.
Yes.
Yes.
Okay.
Doing
Put the shunt in
In
the
the atrial.
ventricle and
Upper
comes to
bottom.
the atrial in your
Bottom.
heart.
Atrium with the upper.
Number two, ventriculo-peritoneal. We go with you to neurosurgery. It's good. It's good. No problem.
It's good.
Naseriye.
No.
Naseriye.
Yes, doctor.
Five hospital. With five
Yes,
hospital.
doctor. Yes.
In the middle of
Yes,
the
doctor.
class. Ventriculo-peritoneal is better.
Ventricle.
Ventriculo-pleural. What is this? Naseriye. What is this? Ventriculo-pleural. What is, where is your plevre in Naseriye's people?
What?
Plevre.
Plev?
Pleural. Do you have internet?
Yes, doctor.
Please search. Please search pleural.
It's in the chest, doctor.
Doctor, in the pulmonary.
Hassane. Hassane, gaze at me. What's your name? Mustafa. Mustafa, you were absent? No. Hassane, who was you all look each other. You like each other. Hassane, Mustafa. Mustafa. Mustafa.
بس بالكرش دكتور.
Where is your clever Mustafa? From Karbala?
Yeah.
Karbala's people pleb is where? Please search. Mustafa
الوسط يعني.
from Karbala. What was your talent? What? Reading.
He has a job. He has a engineering degree.
Engineer. What an engineer? Okay. What course? Engineer of what?
Agriculture.
Okay. Agriculture engineer.
Genetic of
Plants. Monitor.
You are genetic.
Genetic
For plants.
Okay, very good. You could help us about genetic in pediatrics. Maybe after some relationship with each other. Okay, pay attention and find ventriculoplural in Karbala's people. Please search. Do you find it?
Yes.
Do you find it?
Yes, doctor.
Where is the plural? Show me it. In
يلا
yourself.
طلعت شو اسمه؟
Where is your plural?
Here is the
Plural is gym.
Is
The chest.
دكتور.
Yes,
The
doctor.
chest.
Chest.
Okay.
Uh,
Is it
For-
acceptable for you? Is it your advice for people in hydrocephaly do?
No, doctor, maybe it can cause
Okay, how are you? Do you find plural? Do you find? Okay, searching. Please search and see the picture ventriculoplural. Do you find absent girls? Do you find?
yes, doctor.
Yes.
This word
No.
Latin.
Look at me and say no. Please search. Oh, very bad. Girls and boys.
Doctor,
What's your name? Yes. You were absent last session. Why? It's not acceptable. I decrease your score. Every time that you want come, every time you didn't want don't come. It's not acceptable because we are saying some important things about disease, about neonates, about children. Ventriculoplural, okay, not acceptable, okay? But you can see in the books, in the references that we can do. Which one is the best? Which one? Ventriculo.
To the heart or To
Peritoneal
abdominal.
is the best for all of the regions of Arab. Okay? This is shunt. This is shunt. Do you have in agriculture this shunt?
حط لك صودا بالراس.
Can
توديها للبطن.
agriculture have this shunt?
وين يصير؟ بالبطن. لو
This
تحطها
is
بالقلب.
shunt.
لو تحطها
This is shunt that neurosurgery doctors put in the ventricle and in the peritoneum. Okay? What the most complication of this shunt? What do you think?
Infection.
Mustafa, what do you think?
Infection.
As an engineer in culture, in ask you many questions about this. What's the most complication? What do you think?
Doctor, is it
No, Mustafa. No, Mustafa said. Mustafa said.
What is your question?
Where is your glasses? Do you have glasses? Put it.
Yes, my God.
The most complication of this shunt is infection. Okay? Maybe led to peritonite, inflammation of periton, infection. Yes, meningitis is the other one. Meningitis and peritonite.
Doctor, it's available to
No, not herniation. No.
Excuse me, doctor. Can it cause ascites?
Side.
Ascites, accumulation of fluid in that.
Great. Infection, peritoneate, meningitis is the most common complication of shunt, ventriculoperitoneal shunt. You can see, what did you see in this picture?
This is Sean.
This is
Shunt, yes, doctor.
Ventricular peritoneal
and also
Two abdominal.
Atrial.
atrial. Okay?
Okay.
So why two? Why two? For peritoneal and for...
This is picture. I show it to you. Okay?
Okay, now.
Pay attention. You go to surgery ward and you see shunt, and this is related to hydrocephaly. You can see it under the skin, the way of going to the peritoneum. Okay? It goes through fontanel to the ventricle, and you can see the way of going up to peritoneum. Like this. Like this. Neurosurgeon do.
Neurosurgeon. Asking
Neurosurgeon.
how they.
Yes. They go open the skull, the fontanel, put it in, and under the skin send it with special machine, special things, send it under the skin. It goes to the peritoneum. You
From the
can see
sagittal
the
vessel.
way of it.
From the sagittal.
Yes, fontanel.
Fontanel.
From fontanel. Do you find it? If in the ward you can see hydrocephaly and you put a ventriculoperitoneal shunt, please see the way of the shunt. The mother says to you, my children has a shunt, can you show it to you? And you say yes, and she says, oh, this is. Okay?
زميلك başla.
Complication of shunts. Number one,
Infection. Yes.
meningitis,
No.
and many of these children has expired in all of cities of Iraq. In Babel, in Karbala, in Nasiri, in Erbil, in everywhere in the world,
dead.
many of them expired.
أطفال الناصرية.
You can see after shunting them also maybe hydrocephalus. Meningitis is the second one. And it's Staphylococcus,
Staphylococcus.
Corynebacteria,
Cornea.
and this is the nurse.
نفس البكتيريا شنو؟
And measuring the health circumstances. These are
Fontanel.
fontanel and sutures. You have two fontanels, superior and inferior. Nursing care of hydrocephalus. I wanted to ask Mustafa, please read this slide and say to us, because you are a genetic in plants.
Next, care of hydrocephalus assessment and monitoring. Measure head circumference daily. And infants.
Do you explain this statement? What was your name? Faris. From what city?
عراقي هلا يا صاحب النخوة.
Faris. Explain number one.
Number one.
Let me explain and you can
In Arabic or
as a
English, doctor?
genetic plant. Okay, Faris, please say about assessment, health circumstances after putting shots. Why we do it?
تقييم ومراقبة وقياس
In
المحيط مال
English,
الرأس.
please.
English.
No problem. In Arabic, please accept of him in Arabic. Okay.
Okay.
راح يصير تقييم ومراقبة يقيس به المحيط مال الرأس يوميا.
Why you measure head circumstances?
33 and 37.
Why we measure it? After
Yes.
shunting. After putting a shunt
You see the change,
from ventricular
changes
to
in the head.
peritoneal, we measure head
Normal,
circumstances.
normal growth
What
or
about
not?
Nasseria?
nursery.
Yes, دكتور.
Nasriya is dead.
دكتور شلون اقولها على مود شو اسمه يكون النمو
Please
طبيعي.
say in
Yes,
Arabic,
دكتور.
no problem. Why
No,
you
no.
measure her circumstances?
احكي بالعربي.
For
Yes,
example, every day, every 6 hours.
نقيس على مود نعرف النوم مالته طبيعي لو يصير يعني ابو نورمال.
I don't know Arabic.
Yes,
What's your
the
idea?
growth is normal or not?
Any change occur and
Yes.
if the setting benefit or not.
It's changeable in the head, especially in
What
the
was your name?
خذهم من عندك او موجودين؟
That's the best.
عبر
Zina. What was question, Nasseria? What was your question? Say to Zina.
جاي تقول ليش نقيس الراس؟
ايش زي؟
ايش قدر ما صار؟
هو حيكون
هو اقوى
My aim is everybody speak and have interaction with me. No, somebody speak, nobody.
Sleep.
ناصر ايدك
حتى يعرف
لما نقول تستهزئ من 5 سنين شنو هذا؟
We are measuring head circumstances because we wanted to know our shunt is working or no.
Yeah.
If it decrease your circumstances, showed that your shunt doesn't work.
Okay.
Okay? Okay?
Okay.
What's your name? It's your tie. Nice tie. What was your name? Haydar Ali. What's your idea about the others? Assess fundamentals. Please read number 2 and explain in Arabic. Number 2. Assess.
soft.
Say yourself. She puts a nice and says to us about number 2. Okay.
Assess the fundulus, balloonic, ligand, increase intracranial pressure.
Okay. Can you explain it for me?
Because they get the pressure under cranial.
Assess the fontanel.
Yeah.
Is it bulging or no?
The
If
size of
it
the
is
fontanel.
bulging, maybe your shunt doesn't work. Okay? Pay attention. This is very important. And number 3.
Yes,
You have question. Don't forget your question. Please read number 3.
We monitor vital signs, especially for hypertension, bradycardia, or regular
Respiration.
Inspiration.
Neurological assessment.
neurological assessment of conscience.
ما نسولف.
What's the mean, Mahdi?
على الجنب
What
تماما.
it means?
يطير بالانجليزي بس تنسي.
What it means in Arabic say. Okay? That's frontal. Number 3. Why we monitor vital signs for children that is putting the shunt? Mahdi from Karbala.
Yes.
Okay, wanted to say. Okay. In Arabic, please.
We measure vital signs.
Arabic, please.
Arabic?
Yes.
I don't speak Arabic.
Where are you living?
It's Bangladesh.
You are from?
From Kerala. We are an international university.
Couldn't speak Arabic?
Because we can't speak Arabic, I can't speak English.
Okay, say it to English. No problem.
We measure vital signs.
Okay, pay attention to Mahdi introduce for you to English about why we check vital sign and why we check hypertension and bradycardia. You know, hypertension and bradycardia is the signs of intracranial pressure and shows that your shunt maybe doesn't work suitable. Okay. Okay. You have question. Okay. What was your name? Amr asked question from Hasna. Where is Hasna? Okay, ask question.
What is the
Hasna is here.
Can we use
Hasna, okay. Ask.
Can we use Mannitol for these cases for the hydrocephalus?
Doctor.
What is decreasing
Monitor.
Diuretic monitor.
Monitor.
Yes,
Okay.
because I
Ask
know.
Hasna. Hasna.
Can we use it or not? Because
Hasna ask you. Answer to you. Hasna. No. Yes or no? Monitor for decreasing ICP in pediatrics not acceptable because of electrolyte imbalance. Okay. And you ask question from Zainab Ahmed. Zainab Ahmed. Zainab Ahmed. Ask your question. Oh, yes. Forget? Are you sure that you forget your question? Ask Amir. No? Anybody have question? Up to now?
yes, I do.
Okay, ask Zainab.
Okay. What are the assessments that we have to do to the patient in order to check if he's okay or not? Do you know the specific assessments or not?
So we check the vital signs like the
Number one, vital sign. In all of disease, vital sign is the first. For heart disease, for every disease, vital sign is the first. For example, Mahdi says, I have headache. At the first time, vital sign checking is the first. Number one.
First of all, we should check the vital sign as I said.
Vital sign
For
now.
example, blood pressure for the checking hypertension, and also we check the pulse rate for bradycardia or any kind of baby tachycardia. We should check.
Number two, read it please. Neurological assessment. For example, I wanted to know about neurological assessment of Walker. I wanted to show Walker's neural system is healthy or no. What should I do?
No.
Number one,
level of
consciousness. You look at the Walker and see consciousness.
He's semi-conscious.
Is conscious.
Unconscious.
She is confused. She is.
She is.
Oh, and number two, for assessment neural system in Walker, number two,
She is.
irritability.
Doctor, she is conscious.
Number three, seizure.
Doctor, can I check if he feels pain or not?
This is Walker.
Yeah, I check if he feels pain or not. Yeah, pain. Yeah, I check that.
If Walker had surgery
But she
If,
don't
for
have
example,
symptoms.
you have headache, we check number 1, level of consciousness after vital signs. Number 2, irritability. It goes and come back. It goes and come back. This is irritability. And number 3, seizure. And number 4, motor function.
I remember my question about seizure.
About seizure. Okay, what was your question? Zainab is ready for answering to you. Okay.
What's the intervention as a nurse we can do with the patient coming with seizure as a baby, not as a dog?
The baby is seizure. Dr. Tajali said about seizure to you. Yes? Seizure. Convulsion, sepsis. If your baby is seizure in the emergency. Okay, what do you do?
Doctor,
As a nurse, a patient is seizure.
yes.
What do you do?
First, making the position and the
At the first opening airway, A, B, C, D. Number 1, airway. Number 2, breathing. Number 3, circulation. And drugs. We use for controlling. Okay, say. Drugs like dominant, phenobarbital, diazepam. Diazepam is the first one for children. What?
لا 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 عادي.
What about planet?
It can't affect our baby.
Continue.
لا ما يقدر.
cause a side effect.
Diazepam.
Excuse me.
Pay attention. Number 1 for controlling seizure in pediatric emergency moment is diazepam.
But they are used for antipsychotic.
No, I said
Antipsychotic, no for children.
Doctor.
Pay attention. For you maybe, not for children. Not for children. For children, diazepam is the first, and for neonates, phenobarbital is the first. Okay? Dr. Tajali said to you about sepsis, about seizure. Okay? This is related to hydrocephaly. And pay attention to increased cranial pressure and the vomiting, lethargy, irritability, downward gaze, seizure, high-pitched crying, fan changes in feeding patterns is the signs and symptoms of hydrocephaly in children, and you as a nurse, recognition of increased ICP, shunt pain infection, parental involvement and education. That is very, very important. You can see these patients in this position, and they are very, very stressful for families. In Iran, many of the couples, after detecting these children, divorced of each other. Why? Why about in Bible? Nasariya.
Yes, doctor.
If you have these children, are you divorced?
No.
Maybe
No,
in
doctor.
Nasariya do.
It's a test from the.
In Iran and also I'm sure in your
No,
country,
doctor. ايش يعني هذا؟
divorce with each other.
فهمت السؤال انا؟
In Iran, I have a class that's about 5 of them are from Iraq. Okay? They say to me, many of these marriage led to divorce. And one of them said to me, my father have 3 women. Okay?
Yes, it's a prevalent.
She bring
Multi.
It's normal, but not
3 wives,
because
doctor.
it's situation.
He said to me, my father have 3 women and we are 21 children.
He's good man.
21 children?
Yes,
This is good man.
23 women.
Doctor, this
Yes, it's
So-
common here.
He's a nurse in Iran. He's from, I don't know what city, I don't remember. We have about 5 students that are boys and they are living in Iran. We have international students from Iraq also. They said to me that these anomalies in some parts of Iraq is very, very sensitive about them and divorced. Sometimes go and get the other woman. Are you agree?
no, doctor, not common.
I agree.
It's rare.
All of women are disagree. No. But for men, maybe
I'm agree.
They don't
you are
have.
agree.
Yeah.
He's agree that getting 1 or 2 or 3 women.
But they're good, doctor.
In some tribes, you know, you have in Iraq some groups, some tribes
Groupie.
that maybe your belief is different from each other. Maybe these defects, these anomalies is very important. Pay attention, something we have, for example, 2 major thalassemia. Some parents have 2 of the hydrocephaly patients, and it's led to divorce more. Okay? Because I have 2 children with 2 anomalies.
Divorce is not a solution.
It is common. I see it in my country, in my hospitals. The mother said the father has gone. I divorced because of anomaly. Okay? Pay attention, this is finished.
And then
What time is it?
the 11.
Okay, 11. That's okay. And I wanted to write on the table. Papa, please. Okay, do you have any question about?
Doctor, what about the question?
What was your question?
No, the question in the
Oh, the final exam.
The final.
In the exam
Yeah.
about shunt. What's the infection? What's the complication? And
What the
also about the sign and symptom.
Just
At the last session, please don't be absent. I work with you some question of end of term.
Doctor, and just from this slide, this lecture, not from outside?
From all of the subjects related to me.
Yes, not out these slides, not out this lecture.
No, I will say. Okay. The second congenital disease is hemophilia. Dr. Etedal, yes? I said to you, I only review it and show some picture, and maybe something was new for you. We have hemophilia also. Hemo means
Blood.
hemo means
Blood.
blood. Phili means
Hemophobia.
Dr.
Yes.
Etedal said. Dr. Etedal is woman or man?
Female.
Woman. Phili means Nasir, you said
Doctor, I don't see.
man. Where's the class?
هي
It was absent. I
كيف
think.
أنا دكتورة؟
Etedal.
It's never mind. Man or woman?
ها؟ انت جتني.
That's too bad.
الإجابة دكتور علي.
Okay, you have
وإجابة
question?
دكتور علي. عايش بداية العقلية.
Philly is
دكتور
your
دكتور عراقي؟
Etedal.
بتول دكتور بتول؟
لا جابها العميد دكتور اعتدال.
هي بتقول this is بتقول this is
I'm Batul. You remember me? I remember you from
I don't
Australia
remember.
with my hospital.
He's
Philly
very
is
doctor.
long.
Blood.
We have speaking about the other congenitally disease that is X-link. You know what is X-link?
Yes.
X-link. What is X-link? Etedal said what is X-link.
It means it's
Where are you going?
to the X chromosome.
Come soon.
Dr. X.
What's your planet genetic? What's hemophilia? about planet. What's it mean?
Doctor,
Let her remember.
Yes. Etedal said
X-linked is
X-linked
related to
means-
the X chromosome, which is given by the man. So
Okay.
it's related to the female that the man gives. It's a gene, basically.
Okay. Etedal said in X-link, mother is carrier of XH. H means hemophilia, and the man is healthy without any
The victim.
thing. Okay? And we have hemophilia person. This is autosomal X-link, not autosomal. Thalassemia was autosomal recessive, but hemophilia is about sex chromosomal. XX and XY. We have children. What happened for them? XH, X, and X with this,
Why?
XY, and also this X with this one.
X.
The girls is XX, and this one with this one, XY. Okay? What was H? That was here. Okay? We have a boy with hemophilia. This is X-linked form of disease that is about hemophilia. The mother is carrier, the father is healthy. Father, mother. Maybe the woman in this class, the girl in this class, carrier of hemophilia?
It's maybe, no?
Maybe.
We don't know.
Do you have any sign and symptoms?
No.
If you are carrier of a
You don't
gene, do you have any sign and symptoms?
No, you don't know.
No. You
No,
are
we have a
healthy. You
Because carrier.
don't know. Up to marriage. Up to marriage. With a healthy man, you have a boy with hemophilia. A boy was born and your boy have hemophilia. In what age you can see this boy sign and symptom? Dr. Etedal said, what's your name? Taha. From what city? Karbala. Okay. Taha, what's your idea?
In 6 years.
6 years.
In the first month.
I am carrier of hemophilia. I'm this one. Taha. And I married with a man that is healthy. I have a boy.
With the hemophilia.
After 6 years, Etedal said, what age? Taha says. Taha. Please let me ask all of boys and girls. Taha says. You married with a girl that is H, have H, and you have a baby, a boy. Maybe your wife is with H and your boy is this. What's the sign and symptom and from what age? Taha. Taha.
وأنزلنا عليك القرآن.
Bleeding. Your boy have bleeding. When?
And
Taha. Taha. Okay, the back of Taha. What was your name? What was your yes? What was your name? What? Muhammad. Okay, what's your idea? About what? You married with a woman that have an XH and you have a boy. Maybe your boy is hemophilia. What's the symptom and from what age? You be in Etedal class.
No, he was absent.
Okay, Taha wanted to speak about their boy.
Yeah.
Okay.
After cutting the
Pre-cut.
yeah,
Baby have a bleeding.
bleeding. Yeah.
Are you sure?
Yeah. We are
No.
sure.
Why
No, doctor, no.
Doctor, don't say that. Say
Because
Why not?
Because at the first day after birth, okay.
Bleeding from rectum and the joint.
Bleeding from rectum after birth. I am speaking about after birth. Injection. Pay attention. Pay attention.
What the correct answer?
Pay attention. After birth, all of your coagulation factors come from mother.
Okay.
And you didn't have in 30% any sign and symptom. Okay? After birth, you have a neonate that is this boy. You didn't have any bleeding. Okay? You discharge the boy and the mother goes to the home, and after circumcision, in Muslim countries, after circumcision, do you know circumcision? In Iran, we do circumcision for our boys in the first month. What about Iraq? It depends.
Doctor, I say, Doctor, I should say from the first moment we can knowing if the
Okay. It is the first. Number two, after moving the baby, they have bleeding. After moving Taha, your boy, not in 4 to 6. Okay? You have bleeding. You know, I don't know why it's not working. Please say to me, I agree. This. Okay.
What is that here?
I wanted to Okay. We have 13 factors for coagulation. Pay attention to me for hemophily. We have 13 factors for coagulation. Number 1, number 2, up to number 13, we have factors for coagulation. We say to 8 and 9, hemophilia. Okay? Dr. Dawson?
No.
No?
She explained about the hemophilia.
Okay. What is hemophilia?
It's
What is hemophilia?
lack of
I'll explain about hemophilia.
Is the issue with the clotting factor?
We have 13 factors related to clotting. 13 factors, 1 to 13, and the level of them is 65%. For example, Taha is in this class have 13 factors for coagulation, and from 1 to 13, and the level of them is 65%. Okay, all of us. Okay, number 1. 8 and 9 is hemophilia. The other one, what about the other one?
11 is rare.
The other one is coagulopathy. Okay? I will show to you my slide. You have in Iraq some centers for hemophilia.
Yes.
The patients, the boys is common.
Amen.
comes to your clinic and say to Mustafa, I'm hemophilia. My decreasing is in factor 1, in factor 2, in factor 13, okay? 65% factor we have, and the man is in the common form is healthy, the woman is the carrier of the hemophilia, and we have a boy with hemophilia, and it diagnosed after moving, after circumcision the boys, and they have signs and symptoms of bleeding. Okay? Especially bleeding is in joint. Hemarthros is with hemophilia. Hemophilia, hemarthros means bleeding in the joints. What joints?
Leg.
Elbow joint.
Knee, elbows, elbow, wrists.
Pay attention. We have 3 types of hemophilia. Number 1 is severe. Severe. Your factor is lower than 1%. You should have 65% factor, but you have only 1%. The boy comes to your clinic and say to you, Baqir, I am hemophilia, I have factor 0 than 1%. Okay? I have factor only 1%. I sleep and today I have bleeding. Without anything, without any movement. Spontaneously they have bleeding in the joint. Why? Because of the level of factors that should be 65% is only 1%. It's very low, and you should have a spontaneously bleeding in the joint, hemarthrosis you have. Okay?
Maybe not
Especially we have 8 and 9 hemophilia. We say to these 2 1. Okay? Hemophilia. Hemophilia. Common form is factor 8 and number 2 is factor 9. Okay? If you go to clinic of hemophilia, everybody comes to your clinic is hemophilia A. Why? Because this form is more common, and your defect is factor 8, decreasing factor 8. Factor 8 hemophilia is severe, maybe mild, maybe moderate. Okay? One of my students said to me, I am hemophilia, but I'm mild hemophilia.
It's 1 to 5.
1 to 5.
What about mild? He said to me, I didn't have any bleeding.
5 to 50.
Okay? And I went to a hemophilia clinic. A boy comes and said to me, I went to football game. After that, I have bleeding. Okay? That's moderate. That is very, very important. They come to your clinic for what?
For bleeding.
For bleeding they come?
هو عنده bleeding وجه.
For bleeding? For what?
Hemophilia.
After
For what?
activity, they have a joint.
Yes. What do you do in your clinic about hemophilia patients?
Give him aspirin.
Give him
aspirin.
coagulant factor.
اسبرين ولا كوع
aspirin هذا كان شنو؟
هي كيدنج دكتور هي كيدنج.
Okay.
فيتامين اي.
Vitamin A.
K.
K. Pay attention. Pay attention. My deficit is factor 8 or 9, and you give me vitamin K. You said vitamin K, okay? My deficit is factor 8 or factor 9.
give us supplement with the
That's
The
better
blood
that you
transfusion?
give them factor 8 or factor 9.
We give platelets.
We give
Platelets.
platelets. Pay attention, your problem in factor 8 and 9, is it relation with platelets? No.
So what is
We are in hemophilic clinic. We are in hemophilic clinic. Our problem is defective factor 8 and factor 9.
So what is the solution? What is the solution?
Etedalset.
No, not this.
No, sir.
The problem,
Ah.
if the client comes to the clinic and he suffers from hemophilia, which is not, it is type A or B, and if it's type A, which is we're gonna give him the A factor. If he
Okay,
suffer from-
Etedalset.
if
Treatment of hemophilia is injecting the factors that the patient doesn't have. Not platelet, not blood, not everything. Only the factors that they have need. Etedalset?
Probably, I don't know.
Let's have frozen fresh.
Fresh frozen plasma. I will show you. Okay, Margaret, could you open my file? Go and pay.
Recent app
Okay.
and oh,
Close this. Close this. I will go to September.
and file.
I will say to Etedal that what did you see? Okay?
بس على الدعم.
Okay, and the rest of this slide we are review. Okay. Go to the screen.
Play.
View.
لا بلاي no دكتور بلاي.
At the first we review thalassemia. What was
لا
it?
بقى احنا شبيه.
What was it? This is thalassemia. What was it? Planet engineer. What was it?
Evaluation the head.
This is thalassemia, enlargement of the bone
Because the
because of
Iron.
Okay, number 1, why we have these changes? Question on final. Lower
Question
hemoglobin
of final.
online for long time because of hemolysis, because of hepatosplenomegaly, because of iron overload. This is question. Which one the best answer?
First one.
First one. I said to you, lower hemoglobin than 9, that will change the face. What was this?
Shunt? No.
This for subcutaneous drug for I forget the name of the drug.
Tymphus.
Leukocyte filter. Leukocyte filter. This part gets white BC of the blood. Okay? What is this? These are the other kinds of leukocyte filter that we use for decreasing white BC for preventing of inflammation. What is the best chelator? Okay.
This fella.
This fella. Yes.
This fella.
This fella. Question.
What's your idea?
I don't.
Is it acceptable that we get blood from a hemophilic person?
No. Of course not.
Obviously clear.
دكتور شوف
The exam of the final.
دكتور شوف ديسفير
Desperate. This is desperate.
Yes.
Okay, number 3
Subcutaneous.
for exam.
Subcutaneous.
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 This is
Infusion that was for this
this is home infusion.
subcutaneous.
Subcutaneous injection. Around the umbilical, you can inject Destra. Okay? Is it? Okay. What were these?
For blood.
These are leukocyte filter and these are the bag for blood. What is this? Megaly in thalassemia patient. Why? Why enlargement? Where is your spleen? One where is your spleen? Where is your spleen?
Spleen to
Where
here.
is your spleen?
And the left side. Lower left side.
Where is your spleen? What is in the right side? Don't misunderstand. We have hepatosplenomegaly. Why your spleen enlarged?
Because the red blood cell
Try to produce more.
Lysis. Lysis happened in your spleen. Two questions in the exam. Number 1, hemosiderosis. What is hemosiderosis? Addition without distraction.
Distraction, yeah.
Yes.
What it mean?
Overload of the iron.
What it mean? Mahdi, what it mean?
Deformity in the bone.
Mahdi. Why Mahdi? Mahdi, you are tired. Are you in good consciousness? What happened? Go and wash your face and come back. You are tired? Go and wash your hands. What's your idea? We try to wake up all of sleep students and learn to you by force.
Yes.
What's your idea? Hemosiderosis. It's question the final exam is hemosiderosis. What's your mean? Without cell distraction, by using chelator, you can improve it. The other question is final exam. Don't say that, say the question of the exam. I am saying to you exam question.
Yes, thank you.
Hemochromatosis. What is this?
Iron
Cell destruction. For example, iron goes to pancreas and storage and damage pancreas. Go to the heart, damage heart. Go to the glands, damage glands.
the bone.
Not common. Soft tissue is more. Question. Something that you asked me was about alpha. You have alpha in your country too.
No, it's not common.
That's rare, but you have alpha. Don't doubt, you have, but that's rare.
Yeah. Yes.
Okay? We have in our country, in Ahvaz, in Khuzestan, we have. You know Ahvaz, Khuzestan is near you. Is near you, and you have also two alpha. What's alpha thalassemia?
The 4
4G for beta, 2G for alpha, 4G. alpha 4, beta 2.
Sixteen chromosomes.
If
and
one
11
gene is defective, the
Silence.
disease is silent. Maybe you have these genes in your body and you don't know. Maybe the girls in this class have number 1. Number 2, if 2 gene is defective, the disease is minor.
Minor. Yes.
Maybe you are. What about boys? Maybe you are.
Yeah.
Okay?
Okay.
And number 3, if 3 gene is defective, the disease
Major
is
alpha
major
and
alpha
we
and we
see
say
H
H disease. One time we were in hemophilia in the thalassemia clinic, a girl comes to our clinic and said to me, I'm an engineer. I'm an engineer and I'm H disease. I'm H disease. What is H disease?
Major alpha.
Major alpha. Pay attention. If 4 gene defective, we have hydrops. What is hydrops? Hydrops. Hydro means water. Hydrops means a fetus that's watery. Many of them was born dead. This is hydrops. You know, Mahdi, many of gene anomalies led to abortion. You hear some of the women have more abortion. Maybe they have some genetic disorder with each other. Couples should aware about genetic, about this. This is hydrops fetalis, is a watery fetus that is died in the pregnancy period. And we review short hemophilia and go. This is your country.
Yes.
Okay, happy of seeing your country. And during the last few years, there was an increase these hereditary hematologic disorder cases in Najaf City. And therefore there is an urgent need to increase awareness about effects of family marriage. This article has written by Iraqi scientists. They say Najaf City increased hereditary hematologic disorders and they say about family marriage in all of parts of Iraq and Najaf. Do you have from Najaf?
Yeah.
Okay. Okay, from pay attention. Educate the family, the Najaf city about family marriage. This is hemarthrosis, joint bleeding. Epidemiological profile of hemophilia in Baghdad. How many students were from Baghdad?
Best Yusuf, only Yusuf.
Okay, from boys?
Only Yusuf.
Hussein, who was Hussein? You are from Baghdad? Okay. We go to Baghdad. Can you read this and say prevalence of
No, he is shut up.
He changed it.
He's changed it.
Robert, can you read and say to me how is the Baghdad situation?
So, the prevalence of hemophilia increased from 2.7
to 100,000
to each 100,000
Baghdad
males in
situation
2007 to
is about hemophilia serious.
yeah, it's been increased from 2.7 to each 100,000 males in 2007 into 15.5 to 100,000 males.
This article are written by your scientists. It's not about my country. It's about your country. I search about it.
Doctor, it's important in the final exam or not?
Final exam about incidents in Baghdad, no. Incidents of hemophilia in Baghdad is for your awareness about your country, about it.
The time.
Okay, you have 200 hemophilia centers in Iraq.
We don't know.
200 centers for hemophilia shows
What is?
that your population of hemophilia is
big.
more. Hemophilia, the prevalence of the, okay, it's in Baghdad also. Hepatitis C, hepatitis B, HIV were about 20%. HIV, pay attention, it is a bad little country. Okay, the term of hemophilia, as I said to you, a group of bleeding disorders from congenital deficiency, absence of specific coagulation proteins, as I said to you. 80% of all cases of hemophilia, the inherited pattern is ink-sleep. Okay? Something that is very important that I wanted to say with you is mutation. Do you know what is mutation, Zahra?
Yes.
Zahra, what is mutation? Zahra is sleeping, and I beg, what is mutation? Mutation. Pay attention, in thalassemia, 50% is mutation. In hemophilia, 30% is mutation. What's mutation, Zahra? What? Mutation. Gene mutation. Gene mutation. What is this? For example, we didn't have any anomaly in our family. And my mother, my father, my wife, all of them are healthy.
Yes.
And we have a boy with hemophilia.
But you
What
have-
happened?
It's mutation.
Mutation. Pay attention. That is X-linked, recessive. Pay attention. Okay.
We know it's.
Look at this. This is a woman, a mother that's carrier, and you have a son with hemophilia. Okay? Are you agree?
Yeah.
This mother could be have a boy that's without hemophilia? Mahdi?
No. Maybe.
No? You can see.
50-50, doctor.
You can see.
Yes.
You can see a boy that is healthy. Which one? Which one?
أول واحد.
On the
You
left.
can see the picture.
First one to the left.
Okay, that's son number one, okay? A patient with hemophilia comes to a clinic and say, I have a brother, he is healthy. Which one is? This one. This
First one
son
to the left.
is
No.
hemophilia. Okay, this is the pattern of hemophilia in everywhere. Gene mutation. Pay attention about gene mutation. I try to finish it. A or classic question. B or Christmas. Etidarsel. Etidarsel. Do you remember Etidal was man or woman?
It was.
Yeah.
It was.
Diagnostic evaluation.
Doctor, we focus on nursing care, nursing process. not
Okay, if you know the disease, you can be a good nurse.
Exactly.
If you know that hemophilia is bleeding disorder and the bleeding, you can have the best nursing care. Okay? Do you agree with me?
Yeah, of course we agree.
Of course we do.
But about the XX and the cause, main cause, on the chain of chromosomal
Okay, these are very, very important.
The
If
knowledge-
you know that is a genetic disorder and families are responsible, you can educate. You can be the best nurse. Okay? Do you agree with me?
The knowledge-
If you know the knowledge about hemophilia, you can say consult with the parents.
The knowledge is important, for example, is not important. Yes.
Very, very important. You know they have history of bleeding. Very, very important. I think. How you confirm that you have hemophilia or no? How do you confirm a boy has bleeding? How do you confirm?
By factors.
Clinical features like
By 8 factors and 9.
The test is factor analyzing. For confirming, we send your blood
CBC.
for checking all of factors. And the laboratory say to you, you have deficit of factor 8 and factor 9. DNA testing. Is it due in your country? DNA.
Yes, but it's expensive.
In Iran, in family marriage, we suggest to couples, please go and do DNA testing.
In Iraq as well.
As well, it is.
But it's needing a legal consent to do
this test.
Okay, this is very expensive test. For example, I wanted to know as a woman, can I be a carrier of hemophilia? In Iran, I can go and do DNA testing and find that I'm carrier or no.
Doing all of this, their life is simple. And we suspect all of
Pay attention about your family. If you have the other boy in your country, in your family, that you have a hemophilic person, it's necessary. Okay, DNA testing for rich people. Do it. Okay, you are tired and I try to say it. The mother is carrier and you have the sons. You see the children in the emergency with hemarthrosis in elbow, in the joint, all of joints. This is hemophilia clinic. What did you see?
Swelling of the joint.
Changing in the joint and decreasing muscle. Okay? Because of hemophilia. This is, you are in the hemophilic clinic and you see changes in the joints and because of hemophilia.
That is edema or bleeding?
Bleeding.
Can we drain that?
Is it useful,
No.
that drainage? No, it absorbed by using only factors. Okay?
Doctor, what about joint?
That clothing happen or not in this situation?
What about?
Maybe clothing happen.
Clotting
Yes.
by factor, by injecting the factor. It helps to decrease this
No, I mean
bleeding.
because the blood is accumulate, so clothing happen.
No.
Doctor, what about joint?
Joint?
Joint.
Joint?
Knee.
All of joints maybe happen. Knee joint. Maybe happen. Maybe in elbow. Maybe in pelvic.
يابا هسه ايش راح يصير بيتاثر؟
It is decreased muscle because of hemarthrosis.
بيدك على الجوينت يعني ما بيش.
Is-
بس ممكن تفسر
No, necrosis, not necrosis. It is only hemarthrosis and changing the joint and decreasing muscle because of hemophilia. As I said to you, three types we have: severe, moderate, and mild. This is
The moderate.
frozen. bruising in the knee, and something that's very dangerous is bleeding in the head. That's very, very important.
May that cause DIC?
No, no, no. You only have decreasing in factors and you have bleeding, not DIC. No.
Doctor, we should depend just on your lecture rather than lecture of Dr. Atidal for the final.
No, no, for me.
Yes, I know, but with Dr. Atidal we taken a lecture of hemophilia and thalassemia.
Okay.
Also, would you taken
I don't know about Atidal is examiner of you.
We don't know.
I asked Dr. Muhammad.
The final is now going to be
Please read all of
managed
2
by you
files.
and Dr.
But be ready. I asked from Dr. Atidal. I asked from Dr. Muhammad, okay? And factor 8 and factor 9 with using. This is factors. Do you see it? Atidal show it to you?
No.
Pay attention. These are factors. Factor 8, factor 9, factor 13. We have factors in your clinic. The patients come for injecting factors. This is factors in our clinic that the doctor said the dosage of injecting, and we inject there.
Direct.
This is factor 8.
After the patient he has bleeding and we give him a coagulation factor.
Okay.
Where is the blood after coagulation process? Where the blood goes?
Going.
We have a
tumor.
okay. It's absorption, blood absorption by advising clotting factors like factor 8. It absorbs bleeding.
Arteries and in absorb.
Yes. Pay attention. I had a patient from Iran that had gone to Germany. Okay? She said to me that in Germany we use these factors prophylaxis. Okay? Before bleeding they use it. But in my country, I don't know about your country, these are very expensive for us because we are in sanction, but you are not. Maybe in your clinic you use these factors prophylaxis. It's the best policy. This is factor
9.
Factor 8. This is factor 8. These are American factors. You are in sanction and you are not. Maybe you have these factors in your country, as you know. One question. I am a boy, I have hemophilia.
Yes.
I wanted to marriage. What's your suggestion, Hassan?
Mother, not a car.
Hassanin says. I am a boy, I have hemophilia. I wanted to marriage. What's your suggestion for me? With what women I married and what about my children? A boy with hemophilia asked me,
Marriage
what's your idea, Matt?
He should marry a woman
without.
This is a father with hemophilia that every day your clinic asks you, especially men, pay attention. Pay attention. A man with hemophilia asks you, is it possible that I got married?
Yes.
With which one I got married?
He should marry a woman.
You should marry.
They're not
What
correct.
about my children? I'm worried about my children. Hassane, I'm worried too much about my children. What's your suggestion? What's your suggestion?
You should
Marriage without family.
Out family.
not relative.
And married with one woman that she doesn't have XH.
Okay.
Are you agree?
Actual.
Are you agree? Family or non-family? H without H. Okay? Healthy person. What about children?
All the girls
Me.
who have hemophilia.
Hemophilia. Hemophilia.
As a carrier.
Carrier. And boys are?
All the boys doesn't have healthy.
Okay, we say to the man with hemophilia, don't be hesitate, don't be worried. You are healthy person, no problem. Okay? But we afraid of this person.
Transmission.
Why we afraid of them?
Separate of carrier.
Yes, number one, carrier. Number two, if you have a hemophilia man, many of them hepatitis C is positive. Hepatitis B is positive. Sometimes HIV is positive. Are you ready to marry with a man that is infected?
No.
Of course no.
No.
I have a student.
هو يعني اقول له يعني
يابا chance بس.
I have a girl student come to my office and said to me, Doctor, I wanted to marry with a hemophiliac man. What's your idea?
We have no advice. They are.
What's your idea?
We have no advice.
These people are bleeding every month, maybe they have bleeding.
لا تتزوج.
You marry with a man that's every day bleeding. Number one. Number two, he's infected. Maybe hepatitis C, hepatitis B, hepatitis. Okay?
دكتور
Tired, finished.
بعد التايم is over.
Our seven factor. Okay, these are fresh frozen plasma. We are in sanction in Iran. We didn't have factors like you. We use these factors because they are full of factor 8, 9, and all of factors. And question of exam.
This is a question of exam. Question of exam. And
This is nursing, okay? Rest, ice bag,
what rice?
question of no use aspirin, ethanol said, don't do intramuscular injection and finish. Thank you so much.
Doctor, after the lecture, me and Abdullah and Ahmed, you don't marry.
What?
You don't marry.
I don't marry, doctor. Me and Abdullah.
I see later.
Yes.
With 3 women.